Hello everyone, I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology. We have Brad here, my very able assistant, and we're going to take a little bit of time to try to walk you through the steps for your upcoming Rezum prostate steam therapy treatment. It is a really great treatment. We've been having a lot of success doing it, but one thing that's always obvious is that the best outcomes are going to happen if you are as prepared as possible. And we recognize that when we give you instructions or talk to you in the office, it's not always easy to remember everything. So hopefully this will be something you can refer back to, and that will help you along the path of getting this procedure done properly and extremely successfully. Having said that, then let's talk about the different phases that we're going to go through. By this time, we've already discussed the reason behind the treatment, the way the treatment works, and there will be other videos that we'll be able to refer to for that specifically. But the first thing I want to do, and I want to talk to Brad about, is the sort of things that we recognize help in getting you prepared. Brad, when you talk to the guys before the procedure, what are the sort of instructions that you're giving them, and what are important for them to follow to prepare for the procedure?
Yeah, that's a great question. I would say the first thing I go over whenever I do any Rezum preparation is take a look at the medication list. I really want to make sure that they're not on any blood thinners, taking any aspirin. If they are, that means that I have to contact their cardiologist or their primary care physician, request a clearance for them to hold that medication. Second, what I do is request that they drop off a urine sample. We want to make sure that there are no bacteria in the bladder that would cause an infection after the procedure. So anywhere from about 3 to 5 days before the procedure, we'll have them drop off a urine sample off at the local laboratory for the lab to run a culture. I send a message off to Dr. Rockove to send in some antibiotics before the procedure. These are just some prophylactic antibiotics so that we minimize any risk of infection.
Two things we want to avoid. We want to avoid infection. We want to avoid bleeding. So for the infection part of it, one, we want to make sure that you don't have an infection that you're not aware of, and that comes to play with the urine culture 3 to 5 days ahead of the procedure. The other thing we're going to do is we're going to ask you to start antibiotics the day before. Even if there is no infection, we don't want to create an infection. We're going to give you a shot of antibiotics the day of. So we really take that seriously. We're also going to ask that the morning of the procedure, you give yourself an enema. And if you've never given yourself one, I'm sorry, but it has to be done because we want to numb you up for the procedure, and we do that through the backside. We want to make sure the area is not going to promote infection. So no blood thinners for 3 to 5 days, depending on what the blood thinners are. Antibiotics to start the evening before and the day of, and the enema the morning of. So next thing that I'm going to talk about in terms of the preparation applies to some guys, but not to all guys. We want this procedure to be comfortable. And in order to try to get that, every man we do a block. We put some local anesthetic in the area. Very helpful. We will also, for some guys, and this will be dependent upon the discussion that you and I have prior to the procedure in the days before or at the visit before. Some guys we give medications such as Valium or medications similar to that to try to just relax you. We encourage men, if they will allow us to utilize nitrous oxide. It has been a really important addition to their armamentarium. There is nothing you have to do to prepare for that. If for some reason we have not discussed that with you previously, I want you to bring that up with me. If we send in a prescription for those other medications, be sure to take them an hour or two before you come in. If you take a medicine such as Valium or one of its similar types of drugs, it is important that someone drive you to the office. It is not safe to drive once you do that. In all cases, as we'll discuss later, you need to have someone drive you home. What am I missing?
That is everything, Dr. Rockove.
Okay, so that then would be the preparation. Very important. Successful experience is an experience without complications. Those are the things that we can do to try to prevent them. Please do that.